About 11 million people in the US deal with angina, or chest pain that happens when there is reduced blood flow to the heart. Left untreated, the root cause of this symptom can increase the risk of heart attack or heart failure. St. Luke's Comprehensive Angina Relief Program, or CARE for short, is a new dedicated program offering advanced therapies for people who haven't had success with traditional treatments. With us today is Dr. Aaron Grantham, an interventional cardiologist at St. Luke's Mid-America Heart Institute. Thank you for joining us during Heart Month. We appreciate it.
Thanks for having me, Dan.
Dr. Grantham, what causes angina, and how is it different from other types of chest pain like heartburn?
Well, Dan, as you implied, angina is the term we use that indicates a patient is having symptoms because of inadequate blood flow to the heart. This can happen for a number of reasons. Traditionally, we thought of it as people who had a blockage of one of their heart arteries that was causing blood flow impairment so that the muscle of the heart wasn't getting adequate oxygen and nutrients. This is manifest as chest pain, chest pressure, sometimes shortness of breath, and sometimes just fatigue. There are a lot of different causes, and one of the causes we've identified more recently is vasomotor dysfunction. It's not all about the blockage. Some people with no blockage have angina because the blood vessels don't respond appropriately by relaxing to allow more blood flow when someone's exercising or constricting when somebody's sleeping to shunt blood to other organs.
And tell us more about St. Luke's new Comprehensive Angina Relief Program. Who can benefit from this care, and how is it unique?
The Care Clinic was designed because we have offerings that not a lot of other centers have. Things like chronic total occlusion angioplasty, treatment for patients with a complete blockage where the blockage is much harder to treat than, say, an 80% blockage. And this vasomotor dysfunction group, Dr. Danny Jacob leads that. We also are participating in a trial of a new device for people with refractory angina. That's angina that hasn't responded to medical therapy and has no revascularization options. In other words, stents or bypass haven't helped.
And let's talk about some of these innovative treatment options, one being a new device in a leading-edge clinical trial. What can you tell us about the coronary sinus reducer?
The coronary sinus reducer was developed by a company in Israel. It is designed to go into the vein that drains the blood out of the heart. So the arteries carry the blood into the heart muscle extracts the oxygen and nutrients from the blood, and then the blood is returned through the coronary sinus, which is the vein. The sinus reducer effectively narrows that vein to slow exit of blood from the heart so the heart has more time to extract the oxygen and nutrients, and that really seems to help alleviate angina for people who don't have an option for stents, bypass surgery, or medications.
That's great. What can you tell us about other advanced treatment options that are available?
One of the things we've been studying for quite some time are gene therapies that are designed to help blood vessels grow. When people develop blockages, some of them are lucky enough that collaterals, these I describe as nature's bypasses, open up. Sometimes they are recruited, people are born with them, sometimes they grow. We've been trying to inject angiogenic gene therapy, genes that will trigger the heart to grow new blood vessels. This just hasn't panned out, and that's something that we've been less involved in because of the futility we've seen with many of the previous trials. But we're hopeful there'll be something come along in that realm.
And it's such an exciting time in this space right now, Dr. Grantham. And as we wrap up and continue to recognize Heart Month, what are some final thoughts you have for our audience?
I would say if anybody out there has been told by their doctor that they're having chest pain that is angina, it's coming from the heart, from inadequate blood flow to the heart, and they have no options, that's a great time to get on the phone and give us a call in the Care Clinic and see if there's something we can't offer that's not available at their institution.
Well, we appreciate the great work that you and your team are doing, Dr. Grantham, and thank you again for joining us. We appreciate it.
Thank you.
To learn more about St. Luke's Comprehensive Angina Relief Program and other cardiovascular interventions offered at St. Luke's, you can visit stlukeskc.org/interventional cardiology. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks for watching. We'll see you next time on Health News You Can Use.